Hello, this is Dr. Grant Cooper. Welcome back to Office Hours, where we try to answer the questions you've been sending in. Thank you for those questions. The question we're answering in this episode is, what are the most common blunders that people make after an injury? How do we avoid them? And it's a great question. It's one that we get asked a lot in the office as well. And I would say that the most common mistake that people make after all sorts of musculoskeletal injuries is trying to muscle right through them, right? If you get an injury, whether it's a sciatic type of pain or a hamstring strain or rotator cuff tendonitis, if you get an injury, what you want to do is respect the injury. You want to take care of it. You want to get an accurate diagnosis, get it better, and then, in terms of returning to sport, you want to just recognize that there's been this injury, and ideally, you would take a little time to rehab it and then slowly re-enter the sport. Obviously, it's going to depend on things like how severe the injury was, what was it, was there a tear, etc. But as a general rule, you want to make sure that you don't just pretend there wasn't an injury or that you just try to tough it through. You want to respect it, and then you want to rehab it so that you don't just re-injure it when you go back to your sport or back to life. And ideally, when you get back into what you were doing, you build back into it gradually. Thanks for the question. The question we're answering now is, how does diet relate to joint pain? It's a great question. It's a question we get asked a lot, both in the office and online. And the reality is there's a few ways that your diet is going to affect joint pain or the potential to develop joint pain. The most obvious being weight, right? If you can keep an ideal body weight, you're going to be less likely to develop all sorts of problems, most particularly joint pain in the weight-bearing joints like the hips and the knees. So that's kind of an obvious one. The other one, the one that's more commonly asked, is in terms of an anti-inflammatory diet. It's definitely true that keeping an anti-inflammatory diet, which means, not eating processed foods as much as you can, eating omega, good omega-3 fatty acid, plant-based diets as much as you can, and generally eating a lot of fruits and vegetables and limiting red meat, eating fish. All of those things are definitely, there's a lot of reasons in terms of having good health to have an anti-inflammatory diet. But the question we're answering here is, how does that affect joint pain in particular? It's definitely a net positive in terms of helping your joint pain, and it's probably going to depend on the individual. It can only be a force for good. I think that if you have really bad knee arthritis and a lot of pain, changing your diet in terms of the inflammation is probably going to have some help, but you're probably going to have to address the knee arthritis in and of itself as well. But for all of the reasons, from heart to lung to your mental well-being to also joint pain, maintaining a good body weight and eating healthy anti-inflammatory foods like we touched on and like we have other videos about is certainly going to be a good thing for you. It probably won't be the only thing you need to do if you have a real musculoskeletal problem in your neck or your back or your joints, etc. But it's going to be one of the things that you can do to help yourself both get better and also to stay better. Thanks for the question. It's a really important one. This question was about whether or not you should be doing physical therapy before surgery. It's a great question. It's one that I try to talk about a lot because I think it's so important. One of the most common mistakes that people seem to make when they have it, it's especially true when people are going for a hip or a knee replacement, but this really would be true for almost any musculoskeletal surgery that you might be going in for. What a lot of people seem to do is that they say, well, I'm going for my hip replacement, so I'll just stop doing everything because they're going to fix me anyway in a few weeks. So what's the difference, right? Maybe they've been doing therapy, they've been doing injections, they've been trying to get themselves better, but now they're going for the surgery and they just shut down and they end up sitting on the couch. And that's one of the worst things that you could do, because the stronger you go into the surgery, the easier and the stronger you're going to come out of it. The more conditioned you are before the surgery, just the easier it's going to be afterwards. One of the harder things after a surgery is getting the muscles to turn back on, just getting your conditioning back. So obviously, if you're going in for, let's say, a hip replacement surgery, there's going to be limitations on what you can do. That's probably a big reason why you're going for the surgery in the first place. So it's not that you can do everything, but do what you can do. Ideally, if you can work with a physical therapist, you can work to selectively stretch and strengthen the muscles that are going to help you, but not even so much before the surgery, but they're going to be there for you after the surgery, right? That's really at that point, that's really what the focus should be about. And that also goes for conditioning, just the better cardiovascular condition that you're going to be in before the surgery, the better you're going to handle the anesthesia, the better you're going to handle the surgery, the better that you're likely to do on the back end of the surgery. So let's not stop moving. Let's get as healthy as we can, even if you're going for a surgery. This question was about how important is posture in terms of overall health. I think it's a great question. Posture is so important for a whole variety of reasons, starting with one that we don't talk about a lot, which is people tend to feel better about themselves when they're standing up straight and having good posture. But really, to the essence of the question that's being asked in this one, I think is how important is posture for health overall? I think it's important for all sorts of reasons for good health, from even cardiovascular and lung. But what I'll talk about is the musculoskeletal. Having good posture, first of all, to have good posture, it means that you're engaging the muscles in the right way. And having good posture is going to help to take the pressure off of the points that shouldn't be having those pressure and putting them on the places that are more ready to accept that, to accept that stress. So, for example, when people have a head that's tilted forward, so I'll just turn sideways and see if this works. But when people have their heads out like this, instead of back like that, it's kind of like if you're holding a bowling ball above your head. If you hold the bowling ball in front of in front of yourself, it can be a lot harder than if the bowling ball is right over your arm, right? Your head weighs about as much as a bowling ball. So if your head is out in front of you, now the neck has to really strain to keep that head up. Whereas if the head is sitting directly above the neck, then the neck is going to have a lot easier time in terms of supporting the head, and it's not going to take that stress in unusual ways. And that same premise, will go right down the spine and into basically every part of your body. Some parts will be more important, some parts less. But the bottom line is that if you train your muscles um, to support your spine in the right way, it's going to help take the pressure off of it. It's going to help maintain the health and stability of your spine and your whole musculoskeletal system. So these are all great reasons why taking some time to obtain good posture is important and a good idea. And the last thing I'd like to say about that is there's two important ways to obtain and maintain good posture. One is to have some awareness of it, right? Just to be aware of what good posture is, and then to remind yourself to fall into that. But the other equally important aspect of obtaining and maintaining good posture is to, like we touched on before, train the muscles in order to support to support the good posture. And we actually have a video on the exercises that you could be doing to help yourself obtain good posture. It's important because you want the muscles to naturally want to fall into a good posture. It's something that we all need to work on. My wife is constantly reminding me that, especially as a spine and joint doctor, I should be paying more attention to it for myself. So I'll take this moment to also be aware of my own posture, and let's all be aware of our posture. It'll do ourselves good in the long run. Thank you for the question. It's a really important one. I'll see you next one.